Anyone who uses opioids, whether that be prescription or illicit, should learn the signs of an overdose and how to respond. It's also important for their loved ones and people that they work with or that work with them to know how to respond in case of an overdose. So overdoses are most common when the tolerance is lower. So someone may have taken a break or have just returned from a treatment program and then return to using, and their tolerance will be lower and their risk higher for an overdose. If someone is sick or dehydrated, they also are at risk of an overdose because their body metabolizes the drug differently. Also, mixing drugs such as alcohol and opioids can be at much higher risk of an overdose. Also, when drugs are stronger. Right now we have a fentanyl crisis in British Columbia, and many people who are using drugs do not realize the strength of what they're taking. Thus, their risk of overdose is much higher. So how to prevent an overdose? It's really important, and we encourage people to know their health status and to be aware of what's been happening in their lives recently. Have they just gotten over the flu? Their tolerance may have gotten down. Also, we encourage people to not mix drugs. So if you are going out for a night drinking, it's not a good idea to mix that with taking opioids at the same time because you're at much higher risk of an overdose. Also, we encourage people to not use alone. Let someone know that you will be using and to encourage them to come and check up on them. Also, it's really important to do tester shots. If someone is taking a drug, to try it out a little bit at the beginning to see what the strength's like before taking their full dose. Also, talking to an experienced person, someone who has used drugs for a long time and knows how to respond to an overdose, can be really helpful, as well as talking to a trusted healthcare practitioner to learn the signs of overdose and how to respond. Learning CPR. All of us should know how to respond when we find someone who's unconscious or not breathing. And also learn about naloxone. Get trained and get a kit. Also consider taking a safer route for using drugs. Taking something orally or through smoking is safer than injecting. So what are the signs of overdose? If someone is not able to walk or stay awake, they have no or slow pulse, they aren't breathing, sometimes they could be making a gurgling sound or their breaths are very, very slow. Also, they may be very pale. They may have blue around their lips or in their fingertips. They may be very cool to the touch. They may have vomited. Their body could be limp and they do not respond when they are attempted to be woken up. So that person may have had an overdose. To respond to someone who's had an overdose or a suspected overdose, there's an acronym called SAVE ME, which is really useful for remembering the steps. It's very important to stay with the person and say their name, encourage them to breathe, because sometimes that can remind them to breathe and they start breathing on their own. The SAVE ME acronym, the S stands for stimulation. You want to grab their shoulder firmly, say their name, rub your knuckles along their sternum, encourage them to breathe. A is for airway. Clean and sweep their mouth. Make sure there's nothing blocking them like gum or chewing tobacco or vomit from breathing. V is for ventilate. Tilt their head back, plug their nose, and with using a breathing mask, if you have one, start breathing for them 1 breath for every 5 seconds. E is for evaluate. Are they starting to breathe on their own? If they're not, call 911 if you've not already done so, and get your naloxone kit. If at any point you need to leave the person, please put them in a recovery position. If you have someone else that can help you during this time, that person could be helping get the naloxone ready while you breathe or vice versa. So remember, 1 breath for every 5 seconds. M is for muscular injection. So with preparing your injection of naloxone, you want to inject into a large muscle group, the upper thigh, the buttocks, or the upper arm. You can go right through clothes, you don't have to worry about that. And inject the 1 cc of naloxone into that large muscle group. Remembering to continue breathing 1 breath for every 5 seconds. E is for evaluate and support. If after 3 to 5 minutes the person is not starting to breathe on their own, give them another injection of the naloxone, continuing to breathe for them 1 breath for every 5 seconds, and proceed to do that until 911, the emergency response, has arrived or they're breathing on their own. After a person comes to after being revived, they may be distressed, they may be feeling withdrawal symptoms. Encourage that person to seek medical support, go to the emergency ward, talk to the ambulance, because the naloxone can wear off after 30 to 75 minutes and the overdose could return. Also encouraging the person to not use drugs again for at least 2 hours. Naloxone can save a life. The more people who know about how to respond to an overdose, the more people who can be saved. Naloxone also only works to reverse an opioid overdose. It will not harm someone if they do not have opioids in their body. Naloxone kits are available in the Comox Valley, at AIDS Vancouver Island, the Comox Valley Nursing Center, Mental Health and Substance Use, Public Health, the Intensive Case Management Team, as well as St. Joseph's Hospital Emergency Ward. The kits that are available are through the BC Centre of Disease Control. They contain three ampules of 1 cc of naloxone, 3 vanishing point syringes, rubber gloves, a safety breathing shield, as well as in the case there is the Save Me acronym, a helpful sheet for when you are responding to an overdose. How we prepare naloxone for injection: we put our rubber gloves on for your protection and for the other individual. We open the package, and if we're responding to an overdose on our own, we need to remember to be giving 1 breath for every 5 seconds while we're doing this. We hold the ampule of naloxone firmly to the table, and carefully there's a plastic safety cover at the top so that we don't cut ourselves. We swirl the ampule just to make sure that none of the naloxone remains in the top of the vial, holding it firmly, and then we break away from ourselves the top of the vial. Remove the syringe from the package, take the cap off the top of the syringe, put the syringe completely into the vial, draw up the plunger, till all the naloxone is into the syringe. Press out any air that's in the syringe. Don't worry if there's a little bit left in the top. Like a dart, we insert straight into the large muscle group. Press down on the plunger till we hear it click. After the injection of naloxone, continue breathing for the person 1 breath for every 5 seconds. If after 3 to 5 minutes they're not starting to breathe on their own, give them another injection of naloxone, and continue to do this until the emergency response arrives. Once the person starts breathing on their own, they may be very distressed and also be feeling some withdrawal symptoms. Please stay with the person. Also encourage them to go to the hospital or to wait till the ambulance arrives, because the naloxone can wear off after 30 to 75 minutes. and the overdose can return, and naloxone might need to be given again. Thank you for taking the time to learn about naloxone. You could save a life.